The next glass of water you drink could either calm your blood pressure a little or quietly push it even higher, and that difference matters more than most people realize. I'm not talking about lemon, I'm not talking about cucumber slices, and I'm definitely not talking about those trendy powders people dump into water because the label says heart healthy. Some of them actually make the problem worse, especially in seniors who are already taking blood pressure medicine. But there is one addition that has real physiology behind it, one that can help blood vessels relax, one that in some people starts working within hours, not weeks. And before you assume this is another internet miracle, stay with me, because mistake number one is exactly how people turn a helpful idea into a dangerous delay. Before we begin, subscribe for doctor-guided health truths that protect your heart, calm fear, and help you age stronger daily. I'm Dr. Aliza Wright, and I need to make something very clear right up front because this could protect you from a serious mistake. When I say instantly, I do not mean a magical cure in 60 seconds. I mean fast enough that your body can begin responding the same day, sometimes within a few hours. That is very different from curing hypertension. Chronic high blood pressure develops over time and usually needs a bigger plan, not just one drink. But if you understand what to add, how it works, and who absolutely should not try it casually, you can make your plain water a lot smarter and a lot safer. Let me start with Evelyn, because her story shows you why this topic is so confusing and why so many older adults are getting bad advice online. Evelyn was 71, careful, disciplined, the kind of woman who read every health headline she came across. One morning, she saw a video claiming apple cider vinegar in water would flush pressure from the arteries. Another claimed pink salt in water would balance minerals and stabilize circulation. She tried both on different weeks. The vinegar did nothing except upset her stomach, and the salty drink made her rings feel tight by evening. Her blood pressure that night was higher, not lower. She thought her body was broken. It wasn't. The advice was. That's the trap. People assume anything mixed into water becomes medicine. It doesn't. Some additions relax blood vessels, some overload sodium, some spike sugar, some are simply hype with a prettier label. So what is the one addition with the strongest immediate logic behind it? Unsweetened beetroot, usually as beetroot powder, or a nitrate-rich beet concentrate mixed into water. Not a candy red smoothie loaded with fruit juice. Not a beet-flavored sports drink. Real beetroot, because beetroot naturally contains nitrates that your body can convert into nitric oxide. And nitric oxide is one of the compounds that helps your blood vessels loosen instead of clamp down. When blood vessels relax, pressure can come down. Not in everyone, not by 50 points, not as a substitute for emergency treatment, but enough that studies have repeatedly seen blood pressure move in the right direction. That's why cardiologists and dietitians keep returning to beets when people ask about food-based support. There is actual vascular biology here, not just wishful thinking. Now here's where this gets fascinating, because the pathway is almost unbelievable until you understand it. You drink nitrate-rich beetroot. Some of those nitrates get concentrated in your saliva. Bacteria in your mouth help convert them into nitrite. Then after you swallow, your body can further turn that into nitric oxide, especially in conditions where your tissues need better blood flow. That nitric oxide signals the smooth muscle in your blood vessel walls to relax. Relaxed vessels mean less resistance. Less resistance means the heart doesn't have to push as hard to move blood through the system. That is why this works faster than many other food changes. It isn't building new arteries over 6 months. It is influencing vascular tone in real time. And that's also why one of the biggest mistakes I'm going to tell you about can ruin the whole effect before it even starts. But before I get to that mistake, you need to understand plain water itself, because some people hear this topic and assume water alone is the secret. Water matters, yes. Dehydration can make blood pressure readings behave strangely. In some people, it contributes to dizziness and low pressure. In others, especially when the body is stressed, dehydrated, or overheated, it can trigger compensatory changes that make the cardiovascular system work harder, and the readings become misleading. But plain water by itself is not a treatment for hypertension. It is the stage, not the actor. What you add matters. Add sodium-heavy powder, and you may retain more fluid. Add sugar and caffeine, and you may push pressure higher. Add nitrate-rich beetroot, and now you are working with a pathway that can actually help the vessels open. Same glass, completely different outcome. Frank learned that the hard way, and his mistake is incredibly common. Frank was 67 and determined to lower his numbers naturally. He stopped drinking soda and started carrying a large bottle of water mixed with an electrolyte performance blend he bought online. The tub had lightning bolts on it, testimonials everywhere, and the word hydration in huge letters. He assumed hydration meant blood pressure support. For 2 weeks, he drank it twice a day. His blood pressure log got worse. He blamed stress. He blamed age. He blamed his monitor. What he didn't realize was that the powder was built for intense exercise and contained a hefty sodium load, exactly the kind of thing many people with hypertension should be careful with. Frank wasn't helping his circulation. He was salting it. Once he stopped the mix and cleaned up his routine, his readings settled. That brings us to mistake number 7. Expecting a miracle in minutes and then giving up when it doesn't happen. This is where good advice gets thrown away because of bad expectations. If you mix beetroot into water and check your pressure 5 minutes later, you may see nothing. Then you declare it useless, but the body does not work on your stopwatch. This pathway takes time. Digestion happens, conversion happens, vessels respond. In some studies, changes have shown up within a few hours. And with continued use over days or weeks, the benefit can become more consistent. So if someone promises you that 1 sip will drop your blood pressure before you finish breakfast, that person is selling fantasy. Real physiology is powerful, but it still obeys biology. Fast does not mean instant magic. Fast means your arteries may start responding the same day. Mistake number 6 is adding the wrong thing because the packaging sounds healthy, and this one causes more damage than people think. Wellness companies know exactly how to seduce someone with high blood pressure. They use words like mineral balance, cellular hydration, adrenal support, circulation blend. But if you turn the container around, many of these products are built for athletes who are sweating out salt, not retirees sitting at a kitchen table trying to protect their arteries. A lot of them are sodium heavy. Some are packed with stimulants. Some hide caffeine under botanical names, so people drink them at noon and wonder why their heart feels louder by 1 o'clock. If your goal is lowering blood pressure, your water additive should not be a chemistry set. It should be simple, low in sodium, unsweetened, and ideally centered on something with actual evidence behind it. That's how you avoid turning one problem into 3. Let me tell you about Denise, because her story reveals how deceptive healthy products can be, especially when the label looks clean. Denise was 73 and trying to do everything right. She found a red drink powder with beet, pomegranate, berry antioxidants, sea minerals, and natural energy support. It looked perfect. She stirred it into water every afternoon. Then came the headaches, the evening restlessness, and a string of blood pressure readings that were 10 to 15 points higher than usual. She was scared. Was her medication failing? No. The powder contained added caffeine from green tea extract and enough sodium to make me wince, but the front label never said it plainly. Once she switched to a plain, unsweetened beetroot product with no stimulant blend, the chaos settled. Her blood pressure didn't become perfect overnight, but at least the drink had stopped sabotaging her. Mistake number 5 is choosing a sugary beet drink and assuming the word beet makes everything safe, when sometimes the sugar load is doing the opposite of what you want. This matters because many bottled beet beverages are basically dessert wearing a vegetable costume. They are mixed with apple juice, grape juice, concentrates, flavor enhancers, and more sweetness than your blood vessels need. Now yes, beetroot itself can be part of a healthy plan, but flooding your system with a sugary beverage can be a problem, especially if you have insulin resistance, diabetes, weight gain, or you're already prone to blood pressure spikes after meals. People hear natural and forget that blood sugar, weight, and vascular health are deeply connected. If you want the nitrate benefit, get the nitrate benefit. Don't buy a fruit punch and call it cardiovascular medicine. Your arteries can tell the difference even when the label doesn't. Luis figured that out after a month of frustration, and his case taught his whole family something important. He was 69, borderline diabetic, proud that he had replaced his evening dessert with a large bottled beet smoothie from the refrigerated section. He told everyone he was drinking medicine from nature, but his fasting sugars climbed, his weight crept up, and his blood pressure stayed stubborn. He thought beetroot had failed him. It hadn't. The delivery system had. He was drinking a sweet beverage big enough to be a meal, not a targeted nitrate source. We replaced it with a modest amount of unsweetened beetroot mixed into water and paired it with a lower sodium, higher fiber dinner routine. Within weeks, his numbers looked better, his appetite settled, and he finally understood something most people miss. A beneficial ingredient can lose the fight when you hide it inside a harmful pattern. Now we come to mistake number 4. And this is the one almost nobody sees coming. You destroy the helpful mouth bacteria before the beetroot ever gets a chance to work. I know that sounds strange, but stay with me because this is one of the most interesting parts of the whole story. The nitrate in beetroot depends heavily on the bacteria in your mouth to begin its conversion pathway. If you aggressively sterilize your mouth right before drinking it, especially with strong antiseptic mouthwash, you may blunt that conversion. In other words, you can accidentally wash away part of the very machinery you need. This does not mean oral hygiene is bad. Please don't misunderstand me. It means timing matters. If you slam a nitrate-rich beet drink and then wonder why you felt no effect, ask yourself what happened in your mouth first. Sometimes the problem isn't the beetroot, it's the sequence. When I explain this to patients, they usually stare at me like I'm making it up. Because it sounds too odd to be true. But think about it. Your body is not just a stomach and a bloodstream. It is an ecosystem. Helpful bacteria do jobs for you all day long. In this case, certain oral bacteria help reduce nitrate into nitrite, which is part of the chain that supports nitric oxide production. If that chain gets interrupted, the vascular benefit can weaken. And suddenly, a drink that should have been somewhat helpful feels disappointing. This is one reason health advice online gets so messy. A person tries beetroot, nothing dramatic happens, and they tell 10 friends it's nonsense. But they never mention the antiseptic rinse, the cigarette, the salty lunch, the rushed blood pressure check, or the stress response humming in the background. Context decides outcome far more often than people realize. Marianne taught me that lesson beautifully. Because she was doing something healthy in 2 different ways and accidentally making them compete. Marianne was 74, meticulous, and every morning she used an antiseptic mouthwash because she was serious about dental care. 10 minutes later, she drank beetroot mixed into water because her neighbor swore it helped blood pressure. Then she checked her pressure, saw almost nothing change, and announced that beets were overrated. I asked her to walk me through her exact routine. Mouthwash first, beet drink second, blood pressure cuff third. There was the issue. I had her move the strong antiseptic rinse away from that part of the day and focus on a calmer, more consistent routine. Over time, her readings improved modestly, not magically, but enough that she stopped calling the whole idea foolish. Sometimes success in medicine comes from removing interference rather than adding something stronger. Mistake number 3 is drinking the right thing and then taking the wrong reading, which can make a useful strategy look useless or make a mediocre strategy look miraculous. If you measure your blood pressure after rushing up the stairs, after an argument, after coffee, after a full bladder, or while talking, you are not measuring your resting blood pressure. You are measuring your moment, and moments lie. This matters because people often drink beetroot in water, then anxiously strap on the cuff over a rolled sleeve and demand proof, as if the body owes them a courtroom exhibit. It doesn't work that way. If you want to know whether something is helping, you need clean numbers. Same chair, back supported, feet flat, arm at heart level, bare skin, quiet room, rest first, then measure properly. Otherwise, the blood pressure monitor becomes a machine for manufacturing confusion. Samuel found himself trapped in exactly that confusion, and for a week he was certain his pressure was getting worse. He had started beetroot powder in water every morning, but he would drink it, tidy the kitchen, walk outside for the newspaper, come back in, answer a text from his daughter, and then sit down to check his blood pressure. The readings were all over the place. 148 one day, 136 the next, 155 the day after that. He felt defeated, and he was ready to throw the powder away. When I asked him to change only one thing, the testing routine, the story changed. 5 minutes seated, no talking, no errands, no phone, 2 readings, 1 minute apart. Suddenly the wild swings shrank. Did beetroot become a miracle? No, but the noise disappeared. And once the noise disappeared, we could finally see what his real blood pressure was doing. So let me give you the simple testing protocol that protects you from fooling yourself. Because this part is every bit as important as the drink. First, do not measure right after exercise, caffeine, smoking, or emotional stress. Second, empty your bladder. Third, sit quietly for at least 5 minutes. Fourth, place the cuff on bare skin, not over clothing. Fifth, support your arm at chest height and keep your feet flat on the floor. Sixth, do not talk. Seventh, take 2 readings 1 to 2 minutes apart.